NCLEX-RN Practice Exam 1. Question 1. A nurse is reviewing a patient's medication during shift change. Which of the following medication would be contraindicated if the patient were pregnant? Note: more than one answer may be correct. A. Coumadin. B. Finasteride. C. Celebrex. D. Catapras. E. Hapitrol. F. Clofazimine. Answer: A. Coumadin and B. Finasteride. They are both contraindicated with pregnancy. Question 2. A nurse is reviewing a patient's PMH. The history indicates photosensitive reactions to medications. Which of the following drugs has not been associated with photosensitive reactions? Note: more than one answer may be correct. A. Cipro. B. Sulfonamide. C. Naroxen. D. Bactrim. E. Accutane. F. Nitroder. Answer: F. Nitroder. All of the others can cause photosensitivity reactions. Question 3. A patient tells you that her urine is starting to look discolored. If you believe this change is due to medication, which of the following patient's medication does not cause urine discoloration? A. Sulfasalazine. B. Levodopa. C. Phenolphthalein. D. Aspirin. Answer: D. Aspirin. All of the others can cause urine discoloration. Question 4. You are responsible for reviewing the nursing unit's refrigerator. If you found the following drug in the refrigerator, it should be removed from the refrigerator's contents. A. Corgard. B. Humulin injection. C. Uraconase. D. Epigen injection. Answer: A. Corgard. Corgard could be removed from the refrigerator. Question 5. A 34-year-old female has recently been diagnosed with an autoimmune disease. She has also recently discovered that she is pregnant. Which of the following is the only immunoglobulin that will provide protection to the fetus in the womb? A. IgA. B. IgD. C. IgG. D. IgG. Answer: D. IgG. IgG is the only immunoglobulin that can cross the placental barrier. Question 6. A second-year nursing student had just suffered a needle stick while working with a patient that is positive for AIDS. Which of the following is the most important action that nursing students should take? A. Immediately see a social worker. B. Start prophylactic AZT treatment. C. Start prophylactic pentamide treatment. D. Seek counseling. Answer: B. Start prophylactic AZT treatment. AZT treatment is the most critical intervention. Question 7. A 35-year-old male has been an insulin-dependent diabetic for 5 years and now is unable to urinate. Which of the following would you most likely suspect? A. Atherosclerosis. B. Diabetic nephropathy. C. Autonomic neuropathy. D. Somatic neuropathy. Answer: C. Autonomic neuropathy. Autonomic neuropathy can cause inability to urinate. Question 8. You are taking the history of a 14-year-old girl who has a BMI of 18. The girl reports inability to eat, induced vomiting and severe constipation. Which of the following would you most likely suspect? A. Multiple sclerosis. B. Anorexia nervosa. C. Bulimia. D. Systemic sclerosis. Answer: B. Anorexia nervosa. All of the clinical signs and symptoms point to a condition of anorexia nervosa. Question 9. A 24-year-old female is admitted to the ER for confusion. This patient has a history of a myeloma diagnosis, constipation, intense abdominal pain, and polyuria. Which of the following would you most likely suspect? A. Diverticulosis. B. Hypercalcemia. C. Hypocalcemia. D. Irritable bowel syndrome. Answer: B. Hypercalcemia. Hypercalcemia can cause polyuria, severe abdominal pain, and confusion. Question 10. Rogam is most often used to treat, fill in the blank, mothers that have a, fill in the blank, infant. A. Rh positive, Rh positive. B. Rh positive, Rh negative. C. Rh negative, Rh positive. D. Rh negative, Rh negative. Answer: C. Rh negative, Rh positive. Rogam prevents the production of anti-Rh antibodies in the mother that is a Rh positive fetus. Question 11. A new mother has some questions about PKU. Which of the following statements made by a nurse is not correct regarding PKU? A. A Guthrie test can check the necessary lab values. B. The urine has a high concentration of phenylpyruvic acid. C. Mental deficits are often present with PKU. D. The effects of PKU are reversible. Answer: D. The effects of PKU are reversible. The effects of PKU stay with the infant throughout their life. Question 12. A patient has taken an overdose of aspirin. Which of the following should a nurse most closely monitor for during acute management of this patient? A. Onset of pulmonary edema. B. Metabolic alkalosis. C. Respiratory alkalosis. D. Parkinson's disease type symptoms. Answer: D. Parkinson's disease type symptoms. Aspirin overdose can lead to metabolic acidosis and cause pulmonary edema development. Question 13. A 50-year-old blind and deaf patient has been admitted to your floor. As the charge nurse, your primary responsibility for this patient is: A. Let others know about the patient's deficits. B. Communicate with your supervisor your patient's safety concerns. C. Continuously update the patient on the social environment. D. Provide a secure environment for the patient. Answer: D. Provide a secure environment for the patient. This patient's safety is your primary concern. Question 14. A patient is getting discharged from a SNF facility. The patient has a history of severe COPD and PVD. The patient is primarily concerned about their ability to breathe easily. Which of the following would be the best instruction for this patient? A. Deep breathing techniques to increase O2 levels. B. Cough regularly and deeply to clear airway passages. C. Cough following bronchodilator utilization. D. Decrease CO2 levels by increase oxygen intake output during meals. Answer: C. Cough following bronchodilator utilization. The bronchodilator will allow a more productive cough. Question 15. A nurse is caring for an infant that has recently been diagnosed with a congenital heart defect. Which of the following clinical signs would most likely be present? A. Slow pulse rate. B. Weight gain. C. Decreased systolic pressure. D. Irregular WBC lab values. Answer: B. Weight gain. Weight gain is associated with CHF and congenital heart deficits. Question 16. A mother has recently been informed that her child has Down syndrome. You will be assigned to care for the child at shift change. Which of the following characteristics is not associated with Down syndrome? A. Simian crease. B. Brachycephaly. C. Oily skin. D. Hypotonicity. Answer: C. Oily skin. The skin would be dry, not oily. Question 17. A patient has recently experienced a mile within the last 4 hours. Which of the following medications would most likely be administered? A. Streptokinase. B. Atropine. C. Acetaminophen. D. Coumadin. Answer: A. Streptokinase. Streptokinase is a clot-busting drug and the best choice in this situation. Question 18. A patient asks a nurse, "My doctor recommended I increase my intake of folic acid. What type of foods contain the highest concentration of folic acids?" A. Green vegetables and liver. B. Yellow vegetables and red meat. C. Carrots. D. Milk. Answer: A. Green vegetables and liver. Green vegetables and liver are a great source of folic acid. Question 19. A nurse is putting together a presentation on meningitis. Which of the following microorganisms has not been linked to meningitis in humans? A. S. pneumonia. B. H. influenza. C. N. meningitis. D. Cl. difficile. Answer: DCL. Difficile. CL. Difficile has not been linked to meningitis. Question 20. A nurse is administering blood to a patient who has a low hemoglobin count. The patient asks, how long do RBCs last in my body? The correct response is A. The lifespan of RBC is 45 days. B. The lifespan of RBC is 60 days. C. The lifespan of RBC is 90 days. D. The lifespan of RBC is 120 days. Answer: D. The lifespan of RBC is 120 days. RBCs last for 120 days in the body. Question 21. A 65-year-old man has been admitted to the hospital for spinal stenosis surgery. When does the discharge training and planning begin for this patient? A. Following surgery. B. Upon admit. C. Within 48 hours of discharge. D. Preoperative discussion. Answer: B. Upon admit. Discharge education begins upon admit. Question 22. A child is 5 years old and has been recently admitted into the hospital. According to Erickson, which of the following stages is the child in? A. Trust versus mistrust. B. Initiative versus guilt. C. Autonomy versus shame. D. Intimacy versus isolation. Answer: B. Initiative versus guilt. Initiative versus guilt. 3-6 years old. Question 23. A toddler is 16 months old and has been recently admitted into the hospital. According to Erickson, which of the following stages is the toddler in? A. Trust versus mistrust. B. Initiative versus guilt. C. Autonomy versus shame. D. Intimacy versus isolation. Answer: A. Trust versus mistrust. Trust versus mistrust. 12-18 months old. Question 24. A young adult is 20 years old and has been recently admitted into the hospital. According to Erickson, which of the following stages is the adult in? A. Trust versus mistrust. B. Initiative versus guilt. C. Autonomy versus shame. D. Intimacy versus isolation. Answer: D. Intimacy versus isolation. Intimacy versus isolation. 18-35 years old. Question 25. A nurse is making rounds taking vital signs. Which of the following vital signs is abnormal? A. 11-year-old male, 90 bpm, 22 raised min, 170 mm Hg. B. 13-year-old female, 105 bpm, 22 raised min, 105/60 mm Hg. C. 5-year-old male, 102 bpm, 24 raised min, 90/65 mm Hg. D. 6-year-old female, 100 bpm, 26 raised min, 90/70 mm Hg. Answer: B. 13-year-old female, 105 bpm, 22 raised min, 105/16 mm Hg. HR and respirations are slightly increased. BP is down. Question 26. When you are taking a patient's history, she tells you she has been depressed and is dealing with an anxiety disorder. Which of the following medications would the patient most likely be taking? A. Elavil. B. Calcitonin. C. Pergolide. D. Verapamil. Answer: A. Elavil. Elavil is a tricyclic antidepressant. Question 27. Which of the following conditions would a nurse not administer erythromycin? A. Campylobacterial infection. B. Legionnaire's disease. C. Pneumonia. D. Multiple sclerosis. Answer: D. Multiple sclerosis. Erythromycin is used to treat conditions AC. Question 28. A patient's chart indicates a history of hyperkalemia. Which of the following would you not expect to see with this patient if this condition were acute? A. Decreased HR. B. Paresthesias. C. Muscle weakness of the extremities. D. Migraines. Answer: D. Migraines. Answer choices AC were symptoms of acute hyperkalemia. Question 29. A patient's chart indicates a history of ketoacidosis. Which of the following would you not expect to see with this patient if this condition were acute? A. Vomiting. B. Extreme thirst. C. Weight gain. D. Acetone breath smell. Answer: C. Weight gain. Weight loss would be expected. Question 30. A patient's chart indicates a history of meningitis. Which of the following would you not expect to see with this patient if this condition were acute? A. Increased appetite. B. Vomiting. C. Fever. D. Poor tolerance of light. Answer: A. Increased appetite. Loss of appetite would be expected. Question 31. A nurse, if reviewing a patient's chart and notices that the patient suffers from conjunctivitis. Which of the following microorganisms is related to this condition? A. Yersinia pestis. B. Helicobacter pylori. C. Vibrio cholera. D. Haemophilus aegyptius. Answer: D. Haemophilus aegyptius. Choice A is linked to plague, choice B is linked to peptic ulcers, choice C is linked to cholera. Question 32. A nurse, if reviewing a patient's chart and notices that the patient suffers from Lyme disease. Which of the following microorganisms is related to this condition? A. Borrelia burgdorferi. B. Streptococcus pyogenes. C. Bacillus anthracis. D. Enterococcus faecalis. Answer: A. Borrelia burgdorferi. Choice B is linked to rheumatic fever. Choice C is linked to anthrax. Choice D is linked to endocarditis. Question 33. A fragile 87-year-old female has recently been admitted to the hospital with increased confusion and falls over last 2 weeks. She is also noted to have a mild left hemiparesis. Which of the following tests is most likely to be performed? A. FBC full blood count. B. ECG electrocardiogram. C. Thyroid function tests. D. CT scan. Answer: D. CT scan. A carot scan would be performed for further investigation of the hemiparesis. Question 34. A 84-year-old male has been losing mobility and gaining weight over the last 2 months. The patient also has the heater running in his house 24 hours a day, even on warm days. Which of the following tests is most likely to be performed? A. FBC full blood count. B. ECG electrocardiogram. C. Thyroid function tests. D. CT scan. Answer: C. Thyroid function tests. Weight gain and poor temperature tolerance indicate something may be wrong with the thyroid function. Question 35. A 20-year-old female attending college is found unconscious in her dorm room. She has a fever and a noticeable rash. She has just been admitted to the hospital. Which of the following tests is most likely to be performed first? A. Blood sugar check. B. CT scan. C. Blood cultures. D. Arterial blood gases. Answer: C. Blood cultures. Blood cultures would be performed to investigate the fever and rash symptoms. Question 36. A 28-year-old male has been found wandering around in a confused pattern. The male is sweaty and pale. Which of the following tests is most likely to be performed first? A. Blood sugar check. B. CT scan. C. Blood cultures. D. Arterial blood gases. Answer: A. Blood sugar check. With a history of diabetes, the first response should be to check blood sugar levels. Question 37. A mother is inquiring about her child's ability to potty train. Which of the following factors is the most important aspect of toilet training? A. The age of the child. B. The child's ability to understand instruction. C. The overall mental and physical abilities of the child. D. Frequent attempts with positive reinforcement. Answer: C. The overall mental and physical abilities of the child. Age is not the greatest factor in potty training. The overall mental and physical abilities of the child is the most important factor. Question 38. A parent calls the pediatric clinic and is frantic about the bottle of cleaning fluid her child drank 20 minutes. Which of the following is the most important instruction the nurse can give the parent? A. This too shall pass. B. Take the child immediately to the ER. C. Contact the Poison Control Center quickly. D. Give the child syrup of ipecac. Answer: C. Contact the Poison Control Center quickly. The Poison Control Center will have an exact plan of action for this child. Question 39. A nurse is administering a shot of vitamin K to a 30-day-old infant. Which of the following target areas is the most appropriate? A. Gluteus maximus. B. Gluteus minimus. C. Vastus lateralis. D. Vastus medialis. Answer: C. Vastus lateralis. Vastus lateralis is the most appropriate location. Question 40. A nurse has just started her rounds delivering medication. A new patient on her rounds is a 4-year-old boy who is nonverbal. This child does not have on any identification. What should the nurse do? A. Contact the provider. B. Ask the child to write their name on paper. C. Ask a coworker about the identification of the child. D. Ask the father who is in the room the child's name. Answer: D. Ask the father who is in the room the child's name. In this case, you are able to determine the name of the child by the father's statement. You should not withhold the medication from the child following identification. Question 41. A nurse is monitoring a pregnant client with pregnancy-induced hypertension who is at risk for preeclampsia. The nurse checks the client for which specific signs of preeclampsia. Select all that apply. A. Elevated blood pressure. B. Negative urinary protein. C. Facial edema. D. Increased respirations. Answer: A and C. The 3 classic signs of preeclampsia are hypertension, generalized edema, and proteinuria. Increased respirations are not a sign of preeclampsia. Question 42. A nurse is caring for a pregnant client with severe preeclampsia who is receiving 4 magnesium sulfate. Select all nursing interventions that apply in the care for the client. A. Monitor maternal vital signs every 2 hours. B. Notify the physician if respirations are less than 18 per minute. C. Monitor renal function and cardiac function closely. D. Keep calcium gluconate on hand in case of a magnesium sulfate overdose. E. Monitor deep tendon reflexes hourly. F. Monitor I and O's hourly. G. Notify the physician if urinary output is less than 30 milliliters per hour. Answer: C, D, E, F, and G. When caring for a client receiving magnesium sulfate therapy, the nurse would monitor maternal vital signs, especially respirations, every 30 to 60 minutes and notify the physician if respirations are less than 12, because this would indicate respiratory depression. Calcium gluconate is kept on hand in case of magnesium sulfate overdose, because calcium gluconate is the antidote for magnesium sulfate toxicity. Deep tendon reflexes are assessed hourly. Cardiac and renal function is monitored closely. The urine output should be maintained at 30 milliliters per hour because the medication is eliminated through the kidneys. Question 43. When interpreting an ECG, the nurse would keep in mind which of the following about the P wave. Select all that apply. A. Reflex electrical impulse beginning at the SA node. B. Indicated electrical impulse beginning at the AV node. C. reflects atrial muscle depolarization. D. Identifies ventricular muscle depolarization. E. Has duration of normally 0.11 seconds or less. Answer A. C. E. In a client who has had an ECG, the P wave represents the activation of the electrical impulse in the SA node, which is then transmitted to the AV node. In addition, the P wave represents atrial muscle depolarization, not ventricular depolarization. The normal duration of the P wave is 0.11 seconds or less in duration and 2.5 millimeters or more in height. Question 44. When caring for a client with a central venous line, which of the following nursing actions should be implemented in the plan of care for chemotherapy administration? Select all that apply. A. Verify patency of the line by the presence of a blood return at regular intervals. B. Inspect the insertion site for swelling, erythema, or drainage. C. Administer a cytotoxic agent to keep the regimen on schedule even if blood return is not present. D. If unable to aspirate blood, reposition the client and encourage the client to cough. E. Contact the healthcare provider about verifying placement if the status is questionable. Answer A, B, D, E. A major concern with intravenous administration of cytotoxic agents is vessel irritation or extravasation. The Oncology Nursing Society and hospital guidelines require frequent evaluation of blood return when administering vesicant or non-vesicant chemotherapy due to the risk of extravasation. These guidelines apply to peripheral and central venous lines. In addition, central venous lines may be long-term venous access devices. Thus, difficulty drawing or aspirating blood may indicate the line is against the vessel wall or may indicate the line has occlusion. Having the client cough or move position may change the status of the line if it is temporarily against a vessel wall. Occlusion warrants more thorough evaluation via X-ray study to verify placement if the status is questionable and may require a declotting regimen. Question 45. To assist an adult client to sleep better, the nurse recommends which of the following? A. Drinking a glass of wine just before retiring to bed. B. Eating a large meal 1 hour before bedtime. C. Consuming a small glass of warm milk at bedtime. D. Performing mild exercises 30 minutes before going to bed. Answer: C. A small glass of milk relaxes the body and promotes sleep. Question 46. The nurse recognizes that a client is experiencing insomnia when the client reports select all that apply. A. Extended time to fall asleep. B. Falling asleep at inappropriate times. C. Difficulty staying asleep. D. Feeling tired after a night's sleep. Answer: A, C, and D. These symptoms are often reported by clients with insomnia. Clients report non-restorative sleep. Arising once at night urinate nocturia is not in and of itself insomnia. Question 47. The nurse teaches the mother of a newborn that in order to prevent sudden infant death syndrome, it's the best position to place the baby after nursing is select all that apply. A. Prone. B. Side lying. C. Supine. D. Fowler's. Answer: B and C research demonstrate that the occurrence of SIDS is reduced with these two positions. Question 48. A client has a diagnosis of primary insomnia. Before assessing this client, the nurse recalls the numerous causes of this disorder. Select all that apply. A. Chronic stress. B. Severe anxiety. C. Generalized pain. D. Excessive caffeine. E. Chronic depression. F. Environmental noise. Answer: A, D, and F. Acute or primary insomnia is caused by emotional or physical discomfort not caused by the direct physiologic effects of a substance or a medical condition. Excessive caffeine intake is an example of disruptive sleep hygiene. Caffeine is a stimulant that inhibits sleep. Environmental noise causes physical and/or emotional and therefore is related to primary insomnia. Question 49. Select all that apply to the use of barbiturates in treating insomnia. A. Barbiturates deprive people of NREM sleep. B. Barbiturates deprive people of REM sleep. C. When the barbiturates are discontinued, the NREM sleep increases. D. When the barbiturates are discontinued, the REM sleep increases. E. Nightmares are often an adverse effect when discontinuing barbiturates. Answer: B, D, and E. Barbiturates deprive people of REM sleep. When the barbiturate is stopped and REM sleep once again occurs, a rebound phenomenon occurs. During this phenomenon, the person's dream time constitutes a larger percentage of the total sleep pattern, and the dreams are often nightmares. Question 50. Select all that apply that is appropriate when there is a benzodiazepine overdose. A. Administration of syrup of ipecac. B. Gastric lavage. C. Activated charcoal and ethylene cathartic. D. Hemodialysis. E. Administration of flumazenol. Answer: B, C, and E. If ingestion is recent, decontamination of the GI system is indicated. The administration of syrup of ipecac is contraindicated because of aspiration risks related to sedation. Gastric lavage is generally the best and most effective means of gastric decontamination. Activated charcoal and ethylene cathartic may be administered to remove any remaining drug. Hemodialysis is not useful in the treatment of benzodiazepine overdose. Flumazenol can be used to acutely reverse the sedative effects of benzodiazepines, though this is normally done only in cases of extreme overdose or sedation.
Thanks for watching. Please comment, like and share.